Hey guys, welcome back. This is the second video response to some of the questions that have come up in the class lounge. The questions I'll be addressing now are from Kim Burdett. First question Kim had was regarding a client who suffered from intermittent low back pain. The client went to see a physical therapist, and the physical therapist informed the client that exercises involving forward flexion of the spine from a standing or upright position were contraindicated not only for people who have low back pain, but for all individuals. And so Kim wanted to know if what she's doing with her clients is harmful, because she does have her clients perform forward flexion exercises quite often. As far as what the physical therapist was saying, I'd have to agree with him to a certain extent, or her. Generally speaking, you want to avoid exercises that involve a lot of flexion of the spine, even in a healthy individual. And it really depends on the load that's being used. Okay, so with a person with low back pain, it depends on what causes or exacerbates the low back pain. If you have what's called a flexion intolerant person, as they go into flexion type movements, those movements would increase or exacerbate or reproduce their low back pain. Obviously, you want to stay away from flexion exercises with that individual. If you have an extension intolerant person, then extension type moments or hyperextension moments will reproduce or exacerbate their low back pain. It's pretty easy to figure out that you should avoid those types of movements with that individual. With a healthy person, it's not quite as cut and dry. However, from an upright or standing position and a seated position even, with the influence of gravity, forward flexion of the spine can increase pressure on the discs exponentially. It can also place more stress on the posterior ligaments that stabilize the spine. So with lighter loads, it's not as big of an issue, but as loads start to increase, you definitely want to limit lumbar flexion or flexion of the spine to offset any potential risk that you might be posing to the discs or the structures of the spine. So the two exercises that you listed in your post were straight-legged deadlifts and single-leg squat touchdowns. Straight-legged deadlifts, not a terrible exercise. And if you're using relatively light loads, it's probably okay to allow some flexion of the spine. Just because in everyday life, if we bend down to pick something up off the floor, our spines are going to flex. So there is some adaptive potential there. But as the loads start to increase, you're really increasing the potential risk of injury to the spinal structures. And our body, we may not feel anything while we're doing the exercise, but over a period of time, we're kind of like a plastic spoon. You can only bend that plastic spoon back and forth so much before it breaks. Everyone has a different adaptive potential. So while some person can do forward flexion exercises for years without any problems, you might run into another individual who does it for only a few weeks and then they start having some low back pain. So err on the side of caution with your clients. Try to limit the amount of flexion that they exhibit during upright or standing exercises, whether it's deadlifts, squats. Especially with squats, you'll see recommendations to try and squat as low as possible. Get the butt to the ground in some strength and conditioning programs. Well, if you're squatting as low as you can, if someone doesn't have proper extensibility and core stability, then they'll probably go into some lumbar flexion at the bottom. That is something that is definitely contraindicated because it will increase stress to the spine. So I guess general recommendation is if the load is relatively light, let's say up to 10% of the body weight or up to 10% of the maximum load that they can lift for that exercise, it's probably okay to add some flexion to the spine. But as the loads get heavier, you want to limit the amount of lumbar flexion that you're having your clients perform. Also, think about the position that most of our clients stay in all day long. If they're sitting down at a desk, most of the time people sit in a lumbar flex position. They've got thoracic flexion sitting in front of their computer, and then if they have their forward head posture, the lower cervical spine is also in a flex position. So think about it this way with your client's training program. You want to give them exercises that put them into the exact opposite positions of what they spend the majority of their time in during the day. So rather than promoting more flexion, try to think about getting some more extension through their spine. So thoracic extension, cervical extension, maintaining proper core stability, and then if you're having them do deadlift type movements or squatting movements, teach them how to flex and extend from the hip joint while maintaining a nice stable core, and that will help them out immensely.